So we have a really close-up video here and we're seeing what she's complaining of is textured skin. We're seeing some clogged pores, maybe some milia, and all the layers of makeup you may apply to this may not hide all these bumps. So this is a very common complaint in clinic. Hey guys, it's Dr. Daniel Sugai, board certified dermatologist. Let's talk about textured skin. So textured skin is very common and textured skin has many meanings. And like I mentioned before, having makeup on to try and hide it, it won't hide those elevated bumps around the chin, the cheeks, clogged up pores. It can also be called comedonal acne. Comedonal acne is different from inflammatory acne where you have red, painful bumps, or even pustular bumps. You're gonna have blackheads and whiteheads. It can definitely be a pain in the butt where you get all that makeup on and you're still seeing those little fine monomorphic bumps. Textured skin can also be considered as active acne or inflammatory acne, or even acne scarring where you have undulations in the skin, where you have ice pick scarring, rolling scars from acne, and that can be quite hard to fix and hard to hide with makeup or other skincare products. So let's talk about textured skin in general and things you could do at home that's affordable. I'm a big believer in cleansers with salicylic acid or benzoyl peroxide when you have clogged up pores. Salicylic acid is a beta hydroxy acid that's lipid soluble, will clean out your pore. That's the name of the game. Even if they're already clogged, it will help with that, but most importantly, it will help prevent you from getting clogging. And that's what I want to emphasize is I'm all about prevention. Once you wait for that acne bump to come out, whether it's inflammatory or comedonal, it's hard to really go after it, right? So I'm all about once you get it clear, you want to maintain. And I'm not a big fan of pore strips. Pore strips, yes, you could do, but it's just temporary, right? It's quick relief that will be nice and gratifying. You take that pore strip off and you see all those little pillars of dead skin, keratin, trapped sebum, all stuck to the tape. But I've seen people scar themselves with it. I've seen my own nose. I peeled a piece of epidermis off of my nose with the charcoal pore strips that were gifted to me by Biore. So I don't encourage that. I actually discourage that. Also using pore vacuums. I actually had a few patients come in and they had permanent discoloration or actually broken blood vessels called telangiectasias in the area where they try to go after a nasty clogged up pore or milia, and they weren't able to get it. So they end up getting either tweezers or a needle and they poke and they further traumatize the area and they get a scar or a broken blood vessel that would need to be removed with either electrocautery or a pulse dye laser, which we have here in clinic, aka a V-beam laser that goes after the blood vessel. Stay away from that, use gentle cleansers. I'm not into physical exfoliators where you get an exfoliating brush, scrubbing mitt. Don't go for those. I don't like cleansers with beads that will traumatize the skin. That's not well controlled. So I rather have a chemical exfoliant with salicylic acid. So this is Roche-Posay 2%. CeraVe makes a good acne control cleanser with ceramides, hectorite clay, which will absorb excess oil, and niacinamide, which is a vitamin B analog that will help brighten the skin, regulate sebum production, and even help repair the skin barrier with the ceramides. I don't like niacinamide serums, by the way. You could go for an azelaic acid serum if you have hyperpigmentation and congested pores. You can find it up to 10% over the counter, up to 10%, but prescription wise 15% to 20% is what you'd see at the dermatologist. Niacinamide serums though can be too irritating. I'd rather have it mixed into my cleansers, moisturizers, and sunscreens. Another nice salicylic acid cleanser, if you have very sensitive skin, that's not a full 2%. This is 0.5% salicylic acid by the K-Beauty brand that's really blown up, CosRx. They make a nice snail mucin power essence and they make great pimple patches that are hydrocolloid based. So consider this one as well. These two here I mentioned before by La Roche-Posay and CeraVe are 2%. This one's 0.5%. Another nice salicylic acid cleanser that's newer that has mandelic acid and PHA and salicylic acid mixture. This is a Cetaphil Gentle Exfoliating SA cleanser. Brand new, started to use it, very nice. So you have a nice blend of gentle exfoliants. You have mandelic acid, you have the polyhydroxy acid and the salicylic acid all working together to help retexture and smooth out the skin and clean out your pores. So this is really nice. And Cetaphil, just great, you know, for sensitive skin. They've been around for a long time, tried and true brand that works really well. And they do extra testing, making sure that it is good for sensitive skin. Kudos to Cetaphil for doing additional testing. Now, there's benzoyl peroxide that we can talk about. I don't have any trade sizes, but you know, the benzoyl peroxide by CeraVe, Panoxyl. Cetaphil also makes a lower percentage of benzoyl peroxide. So you want to go for a 2.5% like Cetaphil's to 10% benzoyl peroxide. But if you have sensitive skin, maybe go for like 2 to 4% benzoyl peroxide. The 10%, I'd say maybe a little bit better for the body. Although I know a lot of people who can tolerate it on the face. Like myself, I can use a 10% on my face, no problem. But if you're starting off with benzoyl peroxide for your face, just start with 2 to 4%. And those are all great options. Benzoyl peroxide is very nice, especially if you are on acne medications like topical or oral antibiotics. You want to use benzoyl peroxide to help prevent bacterial resistance to your antibiotics. So it works on microbes, the microbes that are involved with acne, and it helps gently exfoliate. Only thing with benzoyl peroxide though, be careful with any residual being on the skin when you come out of the shower, because you can bleach your towels, you can bleach your clothes, your linen. Sometimes you might wash it off completely and it still can bleach your towels. So probably just stick with white towels when you're using benzoyl peroxide. So just a heads up, so that I've had a lot of angry parents and spouses come in because nice towels were ruined with benzoyl peroxide. Salicylic acid, you don't see that, but benzoyl peroxide, that is a real thing. So I say do one or the other at bedtime or in the evening. In the morning, you could do something gentle, like a gentle cleanser, like CeraVe Hydrating Facial Cleanser. If you have oily skin, do their foaming cleanser. And in the evening, after working out, sports, being at school or at work, wash your face with either benzoyl peroxide or salicylic acid. I wouldn't double up on them in a particular day, but fine to have both in your routine. Have one day salicylic acid, the next day do benzoyl peroxide. And if you struggle with body acne, bring it down to your body and wash your body with it, okay? So that's one way of working on textured skin. Could you do leave-on exfoliants in addition to that? Yes, you could. Leave-on exfoliants, I say, probably best to do only 1 to 3 times a week max. And that's like, you know, the glycolic acid toner by The Ordinary. I actually use that every once in a while because it's gone viral. And I actually like that product. But if you wanted to use that, or say Paula's Choice BHA leave-on, the solution, that's fine to do to help further work on your pores, but I wouldn't say to do that every day. And I would not do the leave-on exfoliants the same day as a retinoid. If you're on a retinoid, which we'll talk about, you want to separate that from your leave-on exfoliants. But totally fine to use an exfoliating cleanser, like a salicylic acid cleanser, and then follow up with application of your retinoid. There are different retinoids out there. There's prescription retinoids like tretinoin, tazarotene, triferritine, adapalene 0.3%. And there's over-the-counter retinoids like adapalene 0.1%, retinol, retinaldehyde, retinol. Retinol is a very common topic on the channel. All these retinoids bind to different nuclear receptors, different retinoid receptors. And so some are better at working on pores than others. And say, I don't think retinol is a good, reliable acne medication versus tretinoin, tazarotene, triferritine, and even adapalene. You know, adapalene is over the counter in the US at 0.1% gel. You can find that either as different gel, or I have this tube of Roche-Posay's Effaclar adapalene 0.1% gel. Go for a 45-gram tube if you purchase it over the counter, because it takes 2 to 3 months of nightly use or every other night use to see improvement in the texture and breaking up those whiteheads and those blackheads. It even helps with inflammatory acne. So it takes a little bit of use before you see improvement with a topical medicine like adapalene. So don't give up too soon. And if you're pregnant, do not use a retinoid. Talk to your dermatologist about other options like a topical antibiotic that's safe for pregnancy, or azelaic acid. Adapalene, it's a vitamin A derivative like tretinoin or retinol, but very different. It's a synthetic retinoid that has come out in different formulations. And like I said, 0.1% over the counter, 0.3% is prescription, but a very nice medication. It's probably the best thing you can do for textured skin or clogged pores is using a retinoid at bedtime. I say bedtime because sunlight can deactivate retinoids, specifically tretinoin. I'd say it probably makes the other retinoids somewhat unstable and less effective if you're doing it during the day. Some brands will say, oh, our retinol is photostable. I would say just still use it at bedtime just in case. All you need is a pea-sized amount to your entire face. Retinoids are not meant to be spot treated just to the clogged pores. It's great at prevention, right? It's preventing the lining of the pores from shedding into the pore and clogging them up. And so I say, if you're clear or not clear, apply it to your entire face, pea-sized amount, but don't layer multiple layers of a retinoid. Don't use 2 retinoids. Don't go with a retinol and adapalene all in one night. Choose one and use that one retinoid in a particular night And if you wanted to use tretinoin because you want more of a collagen boosting punch, adapalene might have some benefits with collagen, but we only have limited studies on that. Tretinoin, we have tons of data that supports tretinoin's use for fine lines or wrinkles, hyperpigmentation. So if you wanted to alternate adapalene and tretinoin, retinol and adapalene, totally fine to do, but do it by alternating by the night and not doubling up. I get that question a lot. Can I double up in one particular day on a retinoid? No, keep them separate. If those don't work, should you go for hyaluronic acid or vitamin C serums? No, you don't need vitamin C serums. You don't need hyaluronic acid serums. Yes, hyaluronic acid might help plump up your skin and maybe help with texture, but it's usually not enough plumping to help fill in an atrophic acne scar, especially if it's like an ice pick scar. Hyaluronic acid won't do it. So whenever you buy skincare products, always have a goal in mind. You don't need vitamin C. I talk a lot about vitamin C on the channel, but it's useless for textured skin. And yes, there's some with salicylic acid in it. I think that salicylic acid is better preventing acne and acne prone skin when you use vitamin C, but it's not actively treating anything. So I'd say vitamin C is just best for reducing dark spots, brightening your skin. If you've done all these things, definitely see your dermatologist. We might talk about chemical peels, which is just a larger dose of these exfoliants. We're putting lactic acid, resorcinol, salicylic acid at higher doses on your face, and we're really trying to get into the pore and clean it up. I've had lots of success with clogged pores for myself using chemical peels. You can also argue like, oh, so that's just a temporary relief type of thing. Yes, true, but sometimes you need that jump start. But chemical peels also cause micro trauma to your epidermis and maybe even down to your dermis depending on what peel you're using. And that actually helps with collagen regeneration. And so there's actually long-term benefits that you could get from a chemical peel versus just doing a little leave-on exfoliant that just works on the epidermis. See your dermatologist for chemical peels. It's quite easy to do. You can get it done at your lunch break and go to work and no one will really notice. And a lot of times you won't peel a ton, unless it's a TCA peel, the trichloroacetic acid peel, which goes down to your superficial dermis, and I do that in clinic. That one I have peeled for sure. So they're not all made the same. I don't do phenol peels. There are a lot of YouTube and TikTok videos on phenol peels, but that one requires cardiac monitoring by a physician, so don't go to an esthetician and get those done. That was a very sad case that happened the other month in Brazil. An esthetician performed a phenol peel and the young patient passed away. That's a very different peel from what you would have done in, say, a normal dermatology office here in the US. If you are struggling with acne scars, yes, retinoids could help with acne scars. Chemical peels can help with acne scars, but if it's really severe or significant, you might need to talk to someone about a device, whether it's radiofrequency microneedling or a resurfacing laser. Whether if it's ablative or non-ablative, you might need to see someone for a device to help out with the scarring, okay? Always wear your sunscreen in addition to all these things we talked about, because sunlight itself can open up your pores and make them larger and be more likely to be filled with whiteheads and blackheads. There's a condition called Favre-Rocachot syndrome where you get really large whiteheads and blackheads that are so large that they almost look like raisins stuck under the skin. And so sunscreen, 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 whether you're a teenager or an adult, always wear sunscreen to protect your pores and try to keep them at a good size. If they fill up, they'll open up and they're more likely to get clogged up, okay? Hope this video is helpful. Please hit the like button. Please subscribe to the channel. Please share with your friends who are into skincare. And I'll see you guys for the next video, released every Saturday, 9 a.m. Pacific Standard Time, 12 p.m. Eastern Standard Time. All right, take care. Peace.